Oh, wow.
Okay, I have PCOS. What are my chances of pregnancy? Well, let me explain firstly what PCOS is because many physicians and many patients are kind of confused about what it really is. And it
Okay.
says polycystic ovary syndrome. And many people say, well, it's because you're overweight. Well, that isn't really the cause of it. What is the cause of it is you were born with an excessive number of eggs. Now, that sounds like it should be a good thing to be born with a lot of eggs, but actually, that suppresses your pituitary gland and inhibits you don't recruit, therefore, a dominant follicle at the beginning of your period, and so you don't ovulate and you have irregular cycles. So, having an excessive number of eggs prevents you from ovulating. It gives you estrogen dominant endometrium, which gives you a higher risk of cancer of the uterus when you get older.
Mhm.
It sounds good because you have so many eggs, but it's really a bad thing. Also, because of I'll call it the endocrine system, the way it works is women with PCOS will wind up having a higher testosterone level. Their ovaries are not uh, are just so overloaded that they have a high testosterone level, which gives them a higher appetite, and so they might become obese just because of this high appetite. Uh, so you want to be able to treat the PCOS. Now it's very simple. When you're trying to get pregnant, you do mini IVF and you trigger with Lupron rather than HCG, and you freeze the embryos and you transfer them later. Because otherwise, it's very dangerous to do IVF or ovarian stimulation with women with PCOS. We do it very safely with mini IVF. But if you're not trying to get pregnant, you should be on birth control pills, 21 days on and 7 days off until you're about 40 or so that you don't have this estrogen dominant cycle and you don't have this excessive level of testosterone causing your appetite to be bananas. So PCOS is really simple to treat when you understand what it really is. You should not be allowed to have the irregular cycles of PCOS. And when you're trying to get pregnant, the way to do it is just simply mini IVF and freeze the embryos and transfer them later so you have no risk of hyperstimulation syndrome or multiple pregnancy. That's my very, very shaved down summary of PCOS. I can give you more detail in person if you want to have ever a personal consult. And any of you, by the way, can call us and make an appointment for a personal consult. But that's my brief summary of PCOS.